Excellent. Okay, we've started recording. I will state again, my name is Lori Phillips, and I am your assigned account manager from SISC, and I'm here today to present information on SISC, the plan designs we're offering, the enrollment process, and what you need to know. So with that, there's a little bit of housekeeping. Everyone's mics are muted because sometimes it gets a little hectic. So we're muting everyone. We ask that if you have questions, general questions, if you could put them in the chat feature, which is at the bottom of the screen, you can type it in there. We have staff from SISC as well as your HR department available to answer questions for you. And then at the end of each section, I'll kind of pause briefly to see if there's any unanswered questions that we can share with the whole group and get those answered for you. And please don't share any personal health information when you do put information or questions into the chat. And any questions after this presentation that you have, you can direct them directly to your HR department, and they'll get you answers, or they'll send them over to us and we'll get them to you. So with that, I'm going to take myself off camera because it gets a little distracting. And our agenda today, as I mentioned, is a brief overview of SISC and who we are, the actions required to transition over to SISC, an overview of your new medical plan options. So they're different than what you had under CalPERS. And so we're going to share some information about that with you. And then some important reminders about each of the different plans that are available and some SISC added value programs that are available to you. We'll wrap it up with next steps, due dates, and things like that. And I want to remind you that today's presentation is in regards to the Anthem HMO and PPO plans that are offered to our active employees and our early retirees under 65. Yesterday, we had our Kaiser specific presentation. It was recorded, so at a future date, the district will make that recording available to you if you're interested in looking at a Kaiser plan. But for today, we're focusing on our Anthem plans. So moving forward, SISC overview. So SISC stands for Self-Insured Schools of California, and we are a public schools joint power of authority. So we are a pooling resource for school districts throughout the state of California. We're actually administered by the Kern County Office of Education. So all of our staff are either classified or certificated employees, just like the employees of your school district, but we are the insurance division of the Kern County Superintendent of Schools, and we've been doing this for over 45 years. So when you think of SISC, we're not a broker, we're not an insurance company. We are a pool of school districts joining together to share risk and share cost and spread risk over a much larger population. Now, CalPERS, the pool you were in or you're currently in, is a very large pool, but they have membership from local public agencies and police department, fire department, school districts, other types of municipalities, whereas SISC focuses strictly on school districts. We have over 470 school districts within our pool, servicing over 402,000 members. And a little fun fact, 1 out of every 850 Americans is covered by a SISC plan. So we are the largest school-focused risk-sharing pool in the United States. So you're in good company. So when you come over and you join SISC, there are many other school districts throughout the state who have the same plans that are being offered to your district. So let's talk about the general transition. So anything that you have with CalPERS today it's not going to roll over. There's no automatic rollover. So as of January 1st, 2025, the Berryessa Union School District is moving just your medical benefits from CalPERS over to SISC. Now that's not going to affect your dental or your vision enrollment. It does not affect your CalPERS pension. Okay, we're only talking about medical plans. Through this transition, all employees and retirees must complete a new medical enrollment form. So the enrollment form is the document that gets you into the SISC eligibility system. And from there, we transmit that eligibility to our carriers, such as Anthem or Kaiser. There will be an election form, a plan election form that you'll need to complete to confirm for your school district or your HR department what plan you are electing to enroll in. And then we're going to require you, if applicable, to provide dependent documentation. So we need to verify that your dependents are actually qualified to be in our program. So I'll talk about what that detail is in a minute. So all of the forms, the instructions, the benefit summaries for every plan, those are all available to you on the Berryessa website. And so they've done a great job at putting all the documents that you need to review. The plan options and the details are out there for you. So your open enrollment period is October 1st through October 25th, with all of your medical enrollment form and plan elections due to the HR department by October 25th by 4:30 p.m. And those eligibility documents that I'm going to talk about in a moment, those are going to be collected by American Fidelity. So just the dependent documents for the active employees. So check your BUSD email for the email, that went out regarding the American Fidelity appointments. They're going to be at all the different sites. So you can make an appointment, meet with them, turn in the copies of your documents. They'll verify them to make sure they're okay, and then they'll send them to the school district. So with that, the Anthem PPO and HMO enrollment forms are one combined enrollment form. So it can be used for both. As mentioned, every employee who wants to enroll in a medical plan that's not a Kaiser plan, you're going to need to fill out this enrollment form. So when you go out to the website, you pull it up. This is a PDF fillable. So you can type in all your information. You can even electronically sign it at the bottom if you would like, but you want to make sure that when you do that, that the date and the location and everything prints on the enrollment form. You're going to fill out sections 2, 3, and 4. Is there a 4? Well, the 4th is the arbitrate. Oh yeah, here we go. The 4th, which is the signature of the applicant. So this brown section across the top and down the left-hand side, that's for the school district to complete. You don't have to worry about completing that. You're going to fill in your information. And please note, we need full social security numbers, names, dates of birth, and your email address. We need those full social securities and names for all of your dependents. So any information, any social securities where you only put the last 4 digits or only part of it, or you leave it blank, we will not be able to enroll those dependents. So keep in mind, we need all of that information for this complete enrollment into the SISC system. You're going to need to sign and date the form. Again, dependent eligibility documents are required and submitted to American Fidelity representative. The plan election form and this completed enrollment form will go to the HR department. Now, for those employees that are currently opting out of medical benefits, you may continue to do so. We're not requiring as of January 1 that you enroll in medical benefits, but keep in mind if you have benefits and you want to enroll after January 1, you definitely need to take action. So let's talk about the dependent eligibility documentation that's required. So active employees will submit this information to American Fidelity, not to your HR department. For your spouse, and keep in mind these requirements may be a little bit different than what CalPERS required. Okay, so SISC has our own, since we are our own pool, we have different criteria and requirements. So for a spouse, SISC requires your prior year's tax return, the first page of that tax return that shows married filing jointly or married filing separately. And you can redact the financial information or cross it out. We don't need that information, nor does your school district. We just need to see the first page of the tax form showing married filing jointly, married filing separately with that spouse listed. Now, if you don't file a joint return for some reason, you're going to want to let the American Fidelity representative know that or contact SISC. We do have a workaround. It's used in unique situations. And that affidavit would need to be notarized by both you and your spouse. And we're going to need a copy of the marriage certificate. Okay, that's only if you don't have that tax return, that federal tax return for a joint filing. Now, if you're newly married and maybe you didn't file 2003 taxes together, we will accept the marriage certificate. So it's going to be based on the date that you were married. For domestic partners, SISC requires a certificate of registered domestic partnership issued by the state of California. Okay, that's a law that went into effect. And so if you have a domestic partner and you're not registered, but you'd like to include them on the health benefits or the medical benefits, then please go through the process of registering as a domestic partner. And the SISC plans, your natural children, stepchildren, and or adopted children are eligible to be on the plan up to the age of 26. We need a copy of the legal or hospital birth certificate. And that birth certificate needs to include your parent's name and the child's name and date of birth. I know in the past we had members go online through LA County and request birth certificates or an extraction for a birth certificate, and they only have last names, and we couldn't accept it. So you really need to make sure if you get a copy of the birth certificate that it has the names, at least the employee's name, full name as the parent on the birth certificate. Also, if you've legally adopted a child and they're under the age of 26, we'll need a copy of those adoption papers. For legal guardianship, we do cover those dependents up to the age of 18, and we will need to see a copy of the legal court document granting that guardianship. We have coverage for disabled dependents that are over the age of 26. We need a few more items to certify that those dependents are valid dependents. We need a copy of the legal birth certificate with the parents' names. We need the prior year's federal tax form showing that the child was claimed as an IRS dependent, of course, with the financial information redacted. We'll need proof of 6 months prior credible coverage. And then for the Anthem, we'll need an Anthem disability dependent certification form. So if you do have that overage dependent and you have not had them certified with Anthem, or they're not currently certified with Anthem, reach out to us and we can get you that form so their doctor can complete it and we can put them onto the benefits.
Can you please give an example? What is a proof of 6 months prior credible coverage?
Well, if that child is covered right now under your CalPERS plan, and they
Yes,
have been for the last 6 months, that's
yes.
proof of coverage. You're
Uh,
fine.
So I don't have any forms to bring in for that then.
No, you would. Oh, you would ask for that proof of coverage with the CalPERS or through the carrier, whatever carrier you have.
So I contact Anthem and say, can you give me 6 months proof? And that's just all I have to ask for.
Yes, yes.
I see.
And
Hmm.
if you have that, if they've been certified by Anthem,
Yes.
and they currently are, and you have a copy of that letter, and it could be for a lifetime, it could be 2 years, 5 years, depending on the disability. If you have that, submit it with your enrollment,
So if
please.
I did that, if I did that Anthem disabled dependent certification form last year, it's still viable for this thing.
It would be if it's going for longer than, um, if it's certified past January 1st, 2025. Yes.
Yes, yes, it is.
Okay. Yeah. Yeah. You should.
Okay.
Mhm. Okay. Um, Let me go on to the next section. So I'm going to stop here to ask if there's any unanswered questions right now. Um, any other unanswered questions, HR team or Kimberly?
I don't think so. Not at this time.
Okay, we'll continue on. Okay, so as an active employee of Berryessa and transitioning over to SISC, we have 7 medical plans that were chosen to be offered to the employees. This is a snapshot actually of the top of the plan election form. So you can see we have 4 Kaiser plans, and then we have an Anthem PPO plan and 2 Anthem HMO plans. And I'll talk more about those plans in detail, but the election form is a side-by-side comparison of all of the 7 different plans that are available to you. And at the bottom of the plan election form, you'll see a box that says, please initial under the plan in which you wish to enroll. So you would put your initials if you wanted the PPO plan in, and then you fill out, print your name, signature, school site, and date. You're going to submit that form with your enrollment form to the HR department. Now, I will tell you that it is always the patient's responsibility to verify and confirm your benefits. And you need to double check to see if your providers or your hospitals are in the network or contracting in the plan you elect. And out of network services may not be covered or could result in greater out of pocket expense, of course, if you go out of network. So we'll talk about the plans. We'll talk about how to find providers in your network. And keep in mind, this information is just a brief highlight of in-network costs and benefits, what's presented on your plan comparison, the side-by-side plan comparison. Again, benefit summaries, summary plan booklets that have those details, limitations, and exclusions are found on the district website that are available for you to review. And these rates that you see here, these rates are SISC monthly rates. So this is what we're charging the district, single, two-party, family, for each of the plans so you can get a little bit of a comparison. So while we're looking at the 2, just as an example, the 2 Anthem HMO plans, one uses the select network, the other uses the full network. You can see the price difference. It's about $91 a month less if you go with the select network, but these 2 plans are identical plans. And so I'll show you that in a moment. But there's a reason for, offering different networks, or with Kaiser, different plans. It changes what the premium is that's associated with that plan. Okay. So our Anthem plan options, as I mentioned, we have an HMO Premier plan. This is an Anthem HMO plan. Both of the plans that are offered are identical plans. And so we're offering a $10 copay plan. Both have the same coverage. So everything about the plans are the same. The only difference is the network that you choose to go with the plan you're electing. So the Anthem HMO Full Network is Anthem's largest HMO network. It has more medical groups and providers in it than the Select network. The Select HMO network is what we would call a narrow network or a smaller network. And so some of your larger medical groups are not included in the Anthem HMO Select network. And I think one of the big ones probably in your area is PAMF, or Palo Alto Medical Foundation. If you see doctors at that foundation or at that medical group, you're going to want to elect the full network rather than the select network, unless your specific doctors also go to facilities that are in the select network. Okay. And as you know, if you've been enrolled in an HMO before, that you have no out of network benefits. So everything is filtered to go through your primary care physician or medical group, and they refer you to contracting providers. But they kind of have that gatekeeper model where they manage your healthcare for you. We have a PPO option. It's SISC's name for the PPO is the 90G20 plan. So on this plan, we're also using Anthem's largest PPO network. You'll also see it referred to as the Prudent Buyer Network. It should be the same PPO network that CalPERS uses. The SISC PPO plans primarily require the use of in-network or contracted providers. Some services are not covered if you go out of network or to a non-Anthem contracting provider. So I'll talk more in detail about that if you're interested in the PPO plan in just a moment. So those are the medical plans under Anthem. All of the SISC Anthem plans use Navitus Health for our prescription drugs, outpatient prescription drug coverage. So it's not prescription coverage under Anthem. Okay. It's our pharmacy benefit manager is Navitus. So again, I'll talk a little bit more about that in the future. Okay. In the future. So let's look at the details of the Anthem Anthem HMO Premier $10 plan. So office visits and urgent care, $10 copay. There's no copay for inpatient hospital. There's no deductible on this HMO plan. The emergency room copay and ambulance copay is $100. If you're in the emergency room and you're admitted into the hospital, your emergency room copay will be waived. Out-of-pocket maximum on this plan, and on any of the plans that you look at for your, on the side-by-side comparison, take a look at the out-of-pocket maximum. That's your protection on any plan, that when you have paid out-of-pocket through copays, other out-of-pocket expenses, once you hit $1,000 per individual on this HMO plan, the plan will pay 100% and you won't have any more copays for the rest of that calendar year. So the $1,000 per individual up to $2,000 per family maximum, that's an important piece when you're looking at any medical plan, to know what your protection is, worst case scenario, as long as you're going in network. Okay. HMOs again provide services for provides coverage for in-network services only. Okay, so no out of network. And with the Anthem HMO plans, you must select a primary care physician and indicate who that is on your enrollment form. So I'll show you how to do that and give you an example in just a moment. For SISC, additional Anthem riders that we add to our HMO plans, we have a chiropractic and acupuncture rider, which allows members to self-refer. So you don't have to go to your primary care doctor to get referred for acupuncture or chiropractic. But you can self-refer through the American Specialty Health Network or the ASH network. And the benefit is a $10 copay per visit, up to 30 visits combined. So if you're one that likes to go to the chiropractor a lot, you can use all 30 visits for the chiropractor, or vice versa. If you like all acupuncture, you can use all 30, or you can use all 30 for acupuncture or a combination of the two, up to 30 visits per calendar year. We have a hearing aid benefit that's also added as a rider, which has coverage for one medically necessary hearing aid per ear every 3 years. Member pays 50%. So the cost share on the additional coverages do not count towards your out-of-pocket maximum. So on this plan, if you get a hearing aid, and the plan's paying 50% and your 50% is $4,000, it's not going to cap out at $1,000 because this cost share does not count toward that out-of-pocket maximum. So you can find out that information on the benefit summaries if you want to take a look at it in detail. So health maintenance organizations with Anthem Blue Cross HMO benefits are covered only when services are provided or coordinated by your primary care physician and authorized by the participating medical group or independent practice association, or also known as the IPA, except for OBGYN services received within your members' group. So if you're going to a particular medical group and you want to go have services with the OBGYN, you don't have to have your primary care physician refer you. And services for nervous and mental health disorders and substance abuse, those do not have to be prior authorized either by a primary care physician. So to find a provider, you would go to anthem.com/CA/SISC. This is SISC's microsite. Okay. Once you are on the landing page, you would click on Find Care, and then you're going to choose your network. So do you want the HMO full network, or do you want to see providers under the HMO Select network? So when you'll be directed to the website where you can search for providers by location and type. You would select your location by selecting your zip code and then click on the primary care icon. You can use the key filters and you're want to select or choose the box that indicates serves as a PCP or a primary care doctor. So we're going to be looking for the enrollment. When you find your doctor, you must include that PCP ID enrollment number, or PCP ID, or an enrollment ID. It terms it differently depending on which way you go in. So for each person enrolling, so maybe you want a primary care physician who is a pediatrician for your child, but you want, a general doctor or an internal medicine doctor, whoever serves as a PCP. So you're going to be sure to include this information for each person on the enrollment form. This is a snip from the enrollment form. So you're going to put the IPA or the PCP number in these boxes, and then you're going to tell Anthem whether it is your current provider or not. If it is your current provider, you have easier access, or it's more likely that you will be allowed to continue with that provider. Now, if you leave it blank, you Anthem is going to automatically assign you a provider. Okay, and it's going to be a provider that has that's available to be a primary care physician that's open to take new patients nearest to your home. So if you want that to happen, that's fine. With Anthem, you can change your primary care physicians by contacting Anthem, the customer service number on your ID card, or going through the website and change the primary care physician. But for SISC, when you put in this primary care information, or if you do not put it in, SISC, through the initial enrollment process, takes it one time, and that's it. We cannot update that information for you. So keep that in mind. Once you're enrolled, how it comes in is as much as, or as far as SISC can help you on that. After your enrollment and it's assigned, then you have to work through Anthem. So this is an example. If you go to the Anthem website, and I looked up primary care providers for the zip code 95151. I clicked on Find Care, and I chose Select HMO Network. So this is an example of what it's going to look like. It pulled up a couple doctors here, and you can see the PCP ID number for this doctor, the location of where they're at, and they also have additional locations. This person can serve as a primary care physician, and the ID number is OMM482. So that is the ID number that you're going to want to include on your enrollment form here. Okay. Also, you may notice, and this moved, this particular doctor, the next doctor, shows this PCP number, but it also has additional PCP IDs. So when you click on that highlighted blue, it brings up another box. So this particular doctor is at two different locations. And so he has a primary care doctor number for the Santa Clara IPA, and he has an ID number for Physicians Medical Group of San Jose. So you're going to want to pick whichever one's applicable to you or the location that your doctor's at. Okay. Let me just ask really quick, are there any questions about that, or any unanswered questions about HMO enrollment?
Most of the questions have been about the network and how to look that stuff up. There was a question that I wanted to bring up that someone asked if they have the CalPERS Anthem Select HMO right now, then they take our Anthem Select HMO. Is it safe to assume that those networks are very similar, or no?
They are the same. Yes. So the Anthem PPO network and the Anthem Select HMO network that CalPERS uses and SISC use is the same Anthem network. So you should be fine. You just need to put your doctor's ID number on your enrollment form. Okay. And I'm sure they answered this through the question and the chat, but I'll just say it verbally for those who may not be paying attention to the chat, that the directories are available on the district website. So we had Anthem produce directories for the South Bay and Santa Clara area for both the Select HMO, the full HMO, and the PPO. Okay, so you can pull them up, do a search, and see if you can find your doctor at the different locations. Hi, Susan, you have a question? Let me.
Hi. So as I go search through the HMO looking for my PCP, he doesn't show up. But I'm with him and I've been with him for years. So do I just put in his ID even though he's not
You
on this
have
list?
to put the enrollment guide. It may be that he's not, is, do you currently have Anthem HMO or another HMO product?
I have
That's,
the PPO.
I shouldn't
I
have
have
asked that. I'm
PPO.
sorry.
So
So, um,
no,
if,
I understand you're not trying to you're just trying to help me. I don't think you're doing anything covert. Um,
okay,
Anthem, I've got Anthem, PERS choice, but it's PPO.
okay.
So I think I'm the one that we were trying to respond to in the chat because I can't find my doctor in this list.
Okay, on the PPO list. Now keep in
No,
mind,
I'm in the HMO because that's what I thought we are. We
no, you have a PPO option that I'm getting ready to talk about in a moment.
okay. So before, and I was listening, but there was a word I lost. The HMO select is just like what? What is the
Just
ending?
like the HMO full network. So under SISC, and I'll just back up.
Uh-huh.
So
Yeah.
there's the HMO Premier 10 plan available with a full network or a select network. And then we also have a PPO plan where you don't have to pick a primary care doctor, but you'll want to make sure your doctors are in that network. So both networks, the Anthem HMO full network, if CalPERS offers that, it's going to be the same network. If they offer the select HMO, that's going to be the same as CalPERS. And then and, CalPERS PPO, my understanding is that they use the Anthem PPO Prudent Buyer Network. So you should be fine, but we'll want to double check. And keep in mind when you're looking up your providers. So you may know your doctor as, Dr. let's say Dr. Smith, and he goes by Bill, but his license is under William. So you have to know the exact spelling or the name that your doctor is contracted under, even though they might go by a different name in the office. Okay?
But the last name should be a last name. Like we should be able to search by last name.
You should. You should.
But so it's possible that they've used a different last name.
It depends. It depends. Some of the names could be a little different. And we can take it offline, Susan, and talk about that afterwards if you'd like.
Oh,
Um,
it's fine. I was just confused where like here's a situation where they could have these different names and then it's like, okay, but now does that mean their last name can change? So it's just a thought. Thank you.
you're welcome. Okay, let's continue on. Let's talk about the PPO. And so on our PPO plans, this particular plan, we're offering one PPO plan at Berryessa. It has a $20 office visit, urgent care, and specialty visit copay. And with our SISC plans, only on the PPO, we pay for your first 3 primary care visits. So there is no copay within that first, well, from the first of the year in coverage. You have 3 primary care visits at a 0 copay. But after that, your fourth, fifth, sixth in that calendar year will be a $20 copayment. You also have your industry standard routine preventative exams and lab work at no copay. And that's typical on all plans, whether it be Kaiser, your Anthem HMO, or a PPO plan. Industry standard routine preventative exam and lab work should have no copay. Now, if you start talking about something else like my shoulder hurting and I have a knee problem, something else, they're going to code it differently than a preventative visit. But in general, routine preventative billed to an insurance company should be at no cost. On our plan, there is a $500 per individual deductible up to a maximum of $1,000 per family. And our plans have what we call a last quarter deductible carryover. So something that you're going to learn with SISC is our contract year is October 1st through September 30th. You're accustomed to a renewal on January 1st. So we're bringing you in January 1, and our rates are effective through September 30th. And then our plans renew October 1st. So you're going to have an opportunity for another open enrollment effective October 1st and every year after. So because our program effective date is in October, we don't want members to move into one of our plans and have to satisfy a deductible and then turn around and resatisfy it again in January. So any amount that you pay toward your deductible, so you have a $500 deductible, any amount that you pay during October, November, and December will carry over to next year. So you're not going to feel that, use that, understand that until next year, because you are coming in January 1 and the deductibles and the out-of-pocket maximums reset January 1. So you're not going to really understand that. But next year, when we have another meeting, we'll remind you, and it might make more sense. So after your deductible's satisfied, the plan pays 90%. You would be responsible for 10% coinsurance. Okay. So it is a 90% plan. So your emergency room copay and your ambulance copay is a $100. And then coinsurance applies after that. And I've caught an error here. This says 20%. This is a 90% plan. So really, this should say 10%. And I will correct that before we send the final copy to post for your school district. Out-of-pocket maximum on this plan is $1,000. So I'm an individual. I meet my $500 deductible. The plan starts paying 90%. I pay 10%. My $20 office visit copay, my $500 deductible, and my 10% all go toward that $1,000. And once I hit $1,000 in a calendar year, my out-of-pocket maximum satisfied, and the plan will kick in and pay 100% for the remainder of the year. Again, with out-of-network services, they may be limited or not covered at all. So you want to make sure that you stay in network going to an Anthem PPO provider to have the richest benefits. A couple reminders about our SISC Anthem PPO. Again, the first 3 visits with your primary are at a $0 copay. Some services that are provided by a non-contracting or out-of-network provider are not covered under our plan, and the cost for those services do not apply toward your out-of-pocket maximum. So you want to make sure that you go to an Anthem PPO provider that's contracting in the network for X-ray, imaging, lab, durable medical equipment, and physical medicine, such as chiropractic, physical or occupational therapy, and your routine preventative services. If you go out of network for these services and it's not an emergency situation, we will not cover them. Okay, so Anthem has the largest network of contracting PPO providers of any of the plans. And so I'm encouraging you to stay in network to have the richest benefits. The physical medicine, such as chiropractic, physical, and occupational therapy, require prior authorization after the first 5 visits. Okay, so authorization for the physical medicine is managed by American Specialty Health, the same company that's doing your Anthem HMO and the same company that does the Kaiser, for all the Kaiser plans, is American Specialty Health. They review for our Anthem plans as well. Always call member services on your ID card prior to scheduling any surgeries. Okay, all inpatient surgeries require prior authorization, and some surgeries require the use of special facilities like Centers of Medical Excellence or the Blue Distinction Plus network. So look at your summary plan document or booklet to verify benefits. Call the member service ID number on your card and make sure you ask the questions. You know, is this service covered? Do I need prior authorization? Do I need to use a specific facility for the benefits or the coverage to be paid? Okay. Also on our Anthem PPO plans, we have referenced pricing on 5 common procedures. This is not new. I think CalPERS has it on multiple procedures. SISC only has it on these 5: arthroscopic, cataract surgery, colonoscopy, upper GI endoscopy with biopsy and without biopsy. And basically what it is if you use an in-network outpatient hospital facility. So this is a facility that's associated with the hospital, which is more expensive. And you have, let's say, a cataract surgery. The maximum amount we're going to pay is $2,000, and you will be responsible for the difference. So it's really important when having these services to confirm if you can have them at an ambulatory surgery center. In your region, there should be many, many, many ambulatory surgery centers. If you go to an ambulatory surgery center for one of these types of procedures, then there's no change in the benefit. There's no maximum amount that's going to be paid. It's just going to be paid at 90% of the contracted amount. But if you go to an outpatient hospital, then there are some limits. So keep that in mind. Arthroscopy gets people confused sometimes. That's any type of outpatient surgery, basically. It could be a knee surgery, it could be, you know, an elbow surgery, whatever it may be. Those fall under arthroscopy. So keep that in mind. So Anthem, if you're an Anthem member now, you know. If you're not an Anthem member, let me introduce you. Anthem does have a website. We encourage you to go to the website through SISC's microsite because it has additional information that's specific to our plans available out there when you're looking for providers. You can find doctors or urgent care center near you, wherever you may be. You can print a temporary ID card at the website, or I would encourage you to download the mobile app. Anthem's mobile app is called Sydney Health, and it has an icon that looks like this. I'm not sure why it's called Sydney. It might have been somebody's daughter's name. I don't know, but Anthem's mobile app is Sydney, and it provides access to you along with the online service 24 hours a day, 7 days a week. So, you know, on the website, you can print a temporary ID card. If you're using the mobile app, you can actually pull up a digital copy of your ID card. You can check your deductibles, out-of-pocket maximums, co-insurance, view your claims, your benefits, wellness benefits, fitness trackers. There's a whole lot of information available at the website or through the Sydney app. So I would encourage you, as soon as you receive your ID card, to go out online and register as a member if you haven't done so already. If you are currently using Anthem's online website and you have problems looking at your new benefits, please call Member Services. They can help you click over to the new benefits that you'll have under SISC. You also have care outside of California. When you are within California, you are using Anthem's Anthem Blue Cross. You're using the Anthem PPO Prudent Buyer Network. But outside of California and outside of the United States, you're using the Blue Cross Blue Shield Association Network or the Blue Cross Global Core Network. So that 800-810-BLUE telephone number is on the back of your ID card. This is if you're accessing care and you have an emergency, you're going to want to contact that number, let them know. Oftentimes, if that provider outside of California or outside of the United States is contracting in the Blue Cross Blue Shield Association network, they can bill for you and you don't have to pay the claims or anything up front. So you do have that coverage under the PPO. For the HMOs, you do have urgent and emergent care, but your primary care or your day-to-day care has to be at your primary care physician group in California. Our HMOs are only California-based HMOs. So it's really important to stay within network and know that if you move outside of California as an early retiree, the HMO products are not going to be available to you. So let's talk about the prescription drugs that are associated with your HMO and your PPO plan. As I previously mentioned, the outpatient prescription drugs is through Navitus Health. And on all the HMO and PPO plans that have been selected, it is a 5/20 drug plan. So it's $5 for generic, 20 for brand for up to a 30-day supply. And through our program, you can get most generics at a zero copay, whether it be a 30-day or a 90-day supply through Costco Retail. And I'll talk a little bit more about that. But Costco is kind of our preferred pharmacy. It's not a requirement by no means, but it is the only place that you can get up to a 90-day supply prescription fill is Costco Retail or Costco mail order. Now, an important piece that you need to be aware of is the Navitus, the SISC Navitus network includes most independent and all chain pharmacies except Walgreens. Okay, Walgreens is not part of our network. So if you have prescriptions that you're filling at Walgreens, you're going to need to transfer them to another pharmacy. So it could be the CVS across the street or Rite Aid down the road or Vons or Nob Hill or whoever you guys have in your region. All of them are typically contracted, but Walgreens is not. And there's a reason for that. Years ago, we excluded Walgreens. In the first year, we saved $2.4 million and have saved almost that much, if not more, each year. And so it has not been, it does not make good financial sense to bring them back into the network for the SISC pool. I'll say that. So Costco mail order is most generics at a zero copay. And Your brand name drugs will be a $50 copay. And all mail order is available through Costco mail order, unless you're using a specialty medication. And then Navitus has the specialty RX pharmacies that they contract with, and they can let you know which particular pharmacy will be filling your specialty medication, but all other medications will go through Costco mail order. So again, they are our selected pharmacy benefit manager. The network includes most independents and all major chain store pharmacies. This is a little bit repetitive, and I apologize for that, but we want to make sure you know that we don't include Walgreens. Navitus has their own formulary. So depending on what plan, every medical plan or pharmacy plan has a different formulary. So when determining how drugs are covered, Navitus pharmacists and physicians evaluate the therapeutic value, effectiveness, and side effects to determine medications included in the formulary. From time to time, Navitus adds new coverage, limitations, or removes certain medications from coverage. They do this, or when they do this, Navitus pharmacists and physicians always make sure that high quality, safe, and effective alternatives are available. So we do have lots of medications on the formulary. The large formulary is I think it's 248 pages long. And there should be covered medications in almost every therapeutic class. I will say that some medications require step therapy or prior authorization, and some therapeutic classes use preferred medications. So you should, as soon as you receive your ID cards, I would recommend you call Navitus to find out if your medication's covered, if it requires a prior authorization or proof of step therapy, and get that started before you go live on January 1. So open enrollments now. You're going to turn in your forms. We're going to process them and try to get everybody into the system as soon as possible, with ID cards going out, hopefully the beginning of December. So that should give you probably at least, 2 to 4 weeks prior to the effective date to confirm your medications. So make sure that you contact Navitus or go onto the website to view the most up-to-date formulary. SISC RX plans do not have coordination of benefits. Okay, so our medical plans do coordination, like your PPO, coordinates as primary or secondary, depending on how you're using it or where you were enrolled before or how you're enrolled. But our prescription drugs do not coordinate benefits. So you'll want to make sure that if our copays are less, then you can use our benefits. If the other plan that you're coordinating with has lower copays, you're going to probably want to use that one. Let me finish this section real quick and then I'll take questions. Again, Navitus has a great website. You always want to use, call them. There's a lot of information you can get out of there. You can search for prescription drugs, get copay information, look at your medical history, drug interactions. And then they have Navitus customer care 24/7. That they can be reached by calling them. Now, keep in mind, they're not going to know who you are until you actually are enrolled. So get your enrollment forms in as soon as possible so we can get those processed and get those ID cards out to you so they can answer your questions. And then again, still on the pharmacy benefit. They have for the Anthem PPO members as well as the HMO members. I'll correct that. Again, generics, most generics. We don't do the medications that are narcotic pain medications or cough medicines at a zero copay, but most all other generics are at a zero copay. You can fill at Costco. You can get a 30-day or a 90-day supply through retail. Mail order would be up to a 90-day supply. So when your when your doctor is writing a prescription for mail order, maybe for a maintenance medication, and they're submitting it electronically, you're gonna want to make sure that they're doing the Costco mail order pharmacy in Corona, California. So I'm going to stop and answer questions. Let me see. Are there any questions, Kimberly or HR?
We did just get one. It says, is there any way we can contact Navitus for a general question about specific medication currently on now and find out if covered or not, rather than waiting until we're enrolled and realizing it's not covered?
Okay. There is a process. We won't be able to start it now. I believe after December 1st, so up to 30 days prior, we will give instructions to the district to post of what they can say to Navitus to ask, I'm going to be on this plan. I'm a potential member. And can you tell me if my medication's covered? So, but it's not going to be right now. It's a little bit early in the process, but as of December 1st, it shouldn't be a problem. Okay.
Under HR, the question is which forms are due to HR by the 25th. So on the chat box, we wrote that your enrollment form along with your election plan form are due by the 25th. And if you have an appointment with American Fidelity after the 25th, there will be an HR representative there. So we can pick up the dependent forms when you have your schedule with American Fidelity. Either they will pick it up or we will pick it up.
We've had a lot of questions come in, Lori, that are really surrounding just one provider or another or facility medical group being in network and how to do that. And I know we've already mentioned the directory and everything.
So a little added information for that. Anthem contracts with providers based on their tax ID number. Pardon me. And so I see a Sutter Health just out of the corner of my eye. Anthem does contract with Sutter Health, but it might be individual doctors that you would need to find out if they're contracted in the Anthem PPO network. And you're going to want to look at the location. So I believe Sutter Health, Palo Alto Medical Foundation, they have various sites. And sometimes doctors will be contracted, at a couple different sites. And so Anthem should be able to answer those questions. At the end of this slide, there is a general Anthem number that you can call Anthem, and Anthem should be able to answer that question, asking, I like to go to Dr. William Smith in Santa Clara at this address. Can you tell me if he's contracted in the Anthem PPO network? Or is he part of Anthem Select HMO network? And they should be able to confirm that for you. Okay. Any others, Kimberly?
Um, I don't believe so.
Okay, I'll wrap this up. We'll get through these last couple slides. Give me just a second. Okay, so SISC added value programs. So with our Anthem HMO and PPO plans and even our Kaiser plans in some situations, SISC has added value programs, and they are available to our members at little or no cost. So these are programs that are outside of Anthem, outside of Kaiser, and we offer them to our SISC members who are enrolled in a medical plan. And so we have an employee assistance program. And the Employee Assistance Program is one program that's available to all employees of the school district. So there is a lot of different services or components that are available to um, to this program. You can get short-term counseling, emotional, marital, financial, addiction and recovery help that's available to you at no cost. We will provide the school district with a summary of all of these different added value programs that are available. And then we have individual flyers if you want more detail on each one of these programs. But this is just a quick snippet of I think it's 8 or 9 different programs that we have. Employee assistance available to everybody. For our PPO members, we have Eden Health, which gives you access virtually to a care team that helps with primary care and mental health needs at no cost. We have Teledoc Expert Medical Opinion, which this is available to our PPO and Kaiser members. This allows you access to ask medical questions and get a second opinion through Teledoc for various services. We have our MD Live, which is for our PPO members. This is basically virtual urgent care, which allows you access to board certified physicians, pediatricians, and therapists for a $10 copayment. We have our Vita Health, which is free remote access to a personal health care coach for our PPO members. So whether you're, wanting lifestyle changes such as weight loss or better sleep, or you want to manage a chronic condition, or if you suffer from mild to moderate anxiety or depression, you have access to Vita Health at no cost. Hinge Health is for our PPO members. There is it's digital joint and back pain solutions. So this is a program at no cost to you. You engage with them and they will send you the tools to like a tablet and some sensors to wear to do physical therapy at home if you're suffering from back and joint pain. And all of these programs, we received really high praise and people enjoy using the programs. You'll see that most of these are for the PPO plans. Kaiser and your Anthem HMO medical groups have a lot of these types of services built in to their plans or through their medical groups. Whereas a PPO, PPO members manage their own health care. They don't have to work through a primary care physician or be referred out. So we have to add, or we choose to add additional programs that are available to you to take advantage of at no cost. So, or little cost, little or no cost, I should say. We have a maternity and postpartum support that's available through Maven for our PPO members. And that's gives you care advocates to connect with. This program is really popular. If you engage in your first or second trimester, you could qualify for 6-month diaper service at no cost to you, and you get to pick the company you want to use. So that's important. And then again, our generics at Costco for our PPO members are at a zero copay. So that's kind of a high level look at our added value programs. A couple other noteworthy items for our PPO plans. I mentioned last quarter deductible carryover. We'll talk more about that next year. Primary care or primary coverage versus secondary in coverage. I just want to mention any plan that you're enrolled in as the subscriber is your primary insurance. Any plan you're enrolled in as a dependent would be your secondary insurance. And for the children, the parent who has their birthday first in the calendar year is primary for the children if you have multiple coverages. Keep that in mind. I mentioned this earlier for coordination of benefits. SISC does have coordination of benefits on our medical plans, for especially the PPO plan. You must check your secondary coverage and their coordination rules. And then we do not have coordination of benefits on prescription drugs. And always look at your benefit summaries and your evidence of coverage for the plans that you've selected for the detailed description of the coverages and limitations. Kind of a disclaimer. They're all out there on the district website. So wrapping up, next steps and due dates. You're in your open enrollment period, October 1st through the 25th. All your forms, your medical forms are due October 25th. That would be your enrollment form and your plan election form are due to HR. Your dependent eligibility documents are going to be due to American Fidelity. So make sure you make an appointment with them at the school site or the district office to drop those off to American Fidelity. And then these benefits become effective January 1st, 2025. Again, your next open enrollment to make plan changes, add dependents or drop dependents would be effective October 1st, 2025. Here are some member resources. So you can contact Kaiser Member Services. Here's the telephone number for Anthem for the HMO and the PPO. And then prescription drugs, the telephone number for the prescription drugs. But you want to make sure, give them time because they're not going to know who you are until you're actually enrolled or until we give you the key code about December 1st. And then the EAP and the Teledog benefits, just in case you have questions. So with that, I'm going to wrap up. I'm sorry I've taken a little bit over time. Do we have any additional questions that we would like to ask while we're still recording and in the middle?
I don't think we have any that we haven't answered already in the chat.
Well, thank you very much for joining us for this presentation. Again, check the website, your district's website for additional information as it's added. Make sure you get your enrollment forms in as soon as possible. The crazy thing is the district is collecting like 800 enrollment forms. So don't wait till the last week or the last minute to turn them in. If you're single, fill out your enrollment form and send it in. There's not much you have to do besides fill out one enrollment form and a plan election form. If you have dependents, it's one more step for the dependent eligibility documents, but get them in as soon as possible if you can, please. Rico, do you want to say anything else?
No, just thank you, Lori and Kimberly, for the presentation. And also thank you to the HR staff. I think Sally, Bettina, and Yi are still on. And again, if you have any specific questions about the forms, Sally and Bettina are available. And don't forget to sign up for the American Fidelity appointment.
Excellent. Thank you, everybody, for joining us. We can stop recording now.